Hey everyone, what's up? Dr. Charlie PT here. Hope you're doing wherever you are. Just want to say first things first, thanks so much for checking out my content, checking out my channel. For those of you new to my channel, again, my name is Dr. Charlie. I'm a PT. I have my board specialty in orthopedics, and I specialize in teaching people all around the world with unresolved back, butt, and sciatica problems how to fix themselves naturally using the power of the mind and movement as medicine. And in this video, I want to ask you a question, all right? Is there such thing as too much of a good thing? Is there ever too much of a good thing? And what I mean by this is it possible that you could do too much of an exercise that feels yummy and feels safe and is helping you out? And could it actually backfire on you? Could the thing that is helping you get better actually become your kryptonite if you do too much of it? And this question is for somebody who maybe you're doing exercises that were helping you at some point, but they're just not as effective as they used to be. And or maybe they're making things worse and you're wondering, should I keep doing this? Should I not keep doing this? What's happening? And so in this video, I'm going to answer that question for you, and it's basically provoked by a member of my private coaching program, the Glute Relief Accelerator Program, where we teach people like you how to solve their pain problems. And he said, hey man, I've been doing this motion, which we found was working for him, but now it's not working so well. I'm feeling a little bit stuck. Should I move on? Is it possible that I may be doing too much of this motion and it's backfiring or kind of becoming counterproductive? And the answer is yes. It is possible to have too much of a good thing, to do too much of an exercise when you're trying to get out of pain. So let's start with this and tell you kind of how to solve it, all right? Or how to figure out if you should change exercises or you should keep doing the same thing. If you think of movement as medicine, movement is a prescription, right? And if you go to the CVS or you go to the local pharmacy, you're going to see on that orange pill bottle, you're going to see a prescription. You're going to see a dose, a frequency, and a timing for that medication, right? It's going to tell you how much to take it. It's going to tell you how frequently or how often you should take it. And it's going to also tell you when you should take it. Morning, afternoon, night, with milk, with water, with food, without food, whatever, right? And the same could be said about using motion to solve the problem. If you could find a motion that feels good, could you bottle it up and then manipulate the dose, the frequency, and timing such that you could get relief? And the answer is absolutely yes to that. But just like a pill can be taken too much and then you overdose, right? Not a good thing. Or it can be taken too little and have no therapeutic value. The same can be said about motion. So I see lots of people, for example, who are doing certain motions or certain things, and they're just not doing enough of it. The dose and or the frequency or just the volume in general is not enough to sufficiently challenge the body or the system and cause a change. And so they get no benefit. Or you see people who start with a motion, it's working, and they get excited like we all do when we're noticing some type of relief after we've been stuck in pain for a while. And instead of just doing it twice a day, they do it 3 times a day or 4 times a day or 5 times a day. And they might overdose. Now, they won't die, all right? But they might notice an increase in their symptoms. And so if you're trying a certain exercise and or exercises, maybe you have a disc problem, you're trying press-ups, right? And they were helping, and okay, I'm doing more and more and more. Man, now my back is getting really sore. What do I do? Or maybe you're trying clamshells, right? Like, I need to strengthen my hips or whatever. Okay, there's lots of options out there in case you haven't figured that out. And it was helping, but now, like, man, my butt cheeks are getting really sore. It could be because you're doing too much. If you're not seeing a change, it could be because you're doing too little. And so really the art of trying to solve these problems using the motion side of things is to really fine-tune the prescription so you're not doing too much and causing irritation or fueling it with fear, because the harder you try to solve the problem, the more of a problem obviously it is, or you wouldn't be trying as hard, and you fuel it with attention and fear. Mentally, you increase your sensitivity to the pain experience. Or physically, you just aggravate your tissue because you're doing it too much. But then on the other hand, like I said, if you don't do enough, then you won't see any change. So the art is finding the balance there. And you can imagine if you're doing 10 different exercises, it's going to be very difficult to not only find like the one pill, if you will, that's going to help you out, but then to optimize anything about it, because there's just too many cooks in the kitchen. There's too many variables and too many things potentially interacting. All right? And so just like a medication needs to be optimized for you specifically, a motion needs to be optimized for you specifically. I found some people who do a motion and they do okay doing it just one time, 10 reps in a day, and that's all they need to do, and they get the maximal therapeutic effect. Right? If you take Advil to resolve your pain or try to reduce inflammation if it's present, well, if you take 800 milligrams, maybe that's the therapeutic dose. That's the proper dose, where if you take more, it has negative side effects. If you take less, it's not as optimal. It doesn't help you as much. And so when we find a motion that helps, there's a process for doing that feels safe and improves how you feel and how you move, then we have to artfully change the dose, how much, the frequency, how often, and the timing of when we do it. And to keep this really simple, if you're doing something that's working, don't change it until it proves to no longer be of value, in which case you have two options. So if you're trying things, whatever it may be, press-ups, clamshells, stretches, bird dogs, it doesn't matter, and it was working, but it's no longer working, here's what I need you to consider or think about. You've got two options. One option is you could do more of it. You could do more of it. I plateaued. Could it be that I've just habituated to that dosage, to that amount? It's very possible. Again, I've worked with people in the past who they do one set of 10 reps of something, and they do fine. I've worked with other folks who we have had to maybe do one set of 10 reps 8 times a day. 10 reps compared to 80 reps. And so 10 reps might not be enough for you, or 3 30-second holds, or holding 3 times until you're tired might not be enough for you. You may need to actually just do more to cause a change. So you can live on either extreme. If you're trying something, it was working, but now you're like a little stuck, do more. Double the dose. Now remember, it's got to feel safe, so I would never recommend that you do anything super yucky or that doesn't feel safe, but double the dose. Cool thing is, unlike a pill, right, an Advil or a pain pill or something like that, right, the worst that happens is that you have maybe a slight temporary increase in symptoms. It's pretty much the worst case scenario in which you can lay off, and you know your answer. Okay, it's not that I was doing too little. Well then, what else could it be? Oftentimes, as you're trying to resolve your pain, and you're doing a motion that seems to help, and you're doing it over and over and over and over and over again, your body just gets a little beat up with time. And so as much as you want to improve or feel better, give yourself the permission to just cut it out. That's the opposite extreme. If you're here and you're stuck in the middle, you can do more, double the dose for the next 24, 48 hours, even 3 days, and see, same, better, worse. That'll teach you something, and then you can go from there based off that data. Or drop it out. You ever hear that old saying? It's like, if you love someone, let them go. And if it was meant to be, they'll come back to you. I don't know exactly what it is, but I think you get the idea, right? That's the same technique and or strategy we could apply to motion. Hey, Charlie, this motion was working, but I'm a little stuck, and I'm not so sure about the effectiveness of this thing. Could be anything, by the way. It might not even motion that you're doing to yourself, an exercise. Might be you're not sure if chiropractic's working. Might be you're not sure if acupuncture is working. You're not sure if his medication is working. Consult with your physician before just dropping it out. But you could just drop out that variable. The quickest way to tell if there's value behind any specific intervention or motion or input or treatment or whatever you want to call it is to drop it out. If you drop it out and it was meant to be, it'll come back to you. Meaning if you drop it out and it was truly of value, well then you're going to notice that dropping it out actually makes you worse. That thing was helping you, and when you remove it, you become worse. Or if you drop it out and there's no difference, you still feel just the same without doing it, then was there value in it? Probably not. Charlie, I was doing these clamshells I feel like they were helping, but I'm not really sure. Drop it out. Get rid of them. For the next 3 to 5 days, get rid of them. I still feel just the same as when I was doing them, when I'm not doing them. What does it tell you? No value. If there's value in the treatment or the input that you're trying on, then when you drop it out, your symptoms will get worse. If there's no value, your symptoms will just stay the same. Or, here's sometimes, a lot of times what people find very fascinating to me, is that the very thing which they thought was helping them was actually keeping them from healing. So they drop out the motion, they drop out the clamshell, they drop out the core abdominal bracing, the bird dogs, the press up, all this stuff that they were told and led to believe, hey, this is your solution. And guess what? When they drop it out, they get better. They feel better. And so look, this isn't rocket science. This is isolating variables and running mini scientific experiments. But you've got to be good at running experiments, all right? And so hopefully this was helpful. Hopefully this answers the question of, hey, Dr. Charlie, I was trying all this stuff and I'm feeling a little stuck. How do I figure out what I should do? Well, first things first, minimize the variables. You shouldn't be doing any more than 1 or 2 things. And if you are, you're confused because you're targeting multiple different hypotheses at one time. You've got to pick one hypothesis for an experiment. You can't have 10 running at the same time. Pick one thing, right? And if you're doing one thing, you're like, it was working, but I'm not so sure. Double the dose and or let it go. And if it was meant to be, it'll come back. Meaning it'll give you the data that suggests that, hey, you should start that back up, or you should not, or it never mattered to begin with. All right, hopefully this was helpful for you if you're a little bit of sticking point in your healing journey. If this was useful, let me know. And look, if you're trying lots of different exercises and you're not really sure what you're targeting, if you're doing press-ups and you're doing clamshells and you're doing leg lifts and you're doing this stretch and that stretch, then don't take this the wrong way, but you clearly don't know what's happening because you're trying too many things at one time. And again, you're testing many different variables and hypotheses. Is it my back? Is it my hip? Is it this? Is it that? Maybe it's none of it. And you're barking up the wrong tree. If you're interested in getting to the bottom of what is the most likely source of my pain, then feel free to check out my DIY diagnostic guide. I call it better than an MRI DIY diagnostic guide because I truly believe that. Most people, they do not need imaging, things like that. Obviously, images are really good at ruling out big, ugly, scary things, fractures, tumors, infections, but there's generally signs for that. And instead, most people, following a very simple algorithmic approach, can determine the most likely source and or driver of their symptoms, okay? Whether it be their brain and or the body and all the different structures within it, okay? So check that out. There will be a card above, and let me know your thoughts below. Was this helpful or was it not? Thanks so much, everyone. Take care.